Hi, I'm Kate Marie and I'm from Slow Aging, and today I'm here with Dr. Jason Kaplan, who's a cardiologist and he works at Macquarie University. Hi Jason.
Hi Kate, how are you?
Great, thanks for seeing me. I'm really excited about this consult.
Great, it's a pleasure.
Talk to me, Jason, about the intersection of diabetes and heart disease. How does that work? Because there's a lot of people that have got problems with both.
So there's a really strong association between diabetes and heart disease. In actual fact, diabetes is one of the major causes of heart disease in the Western world and in Australia especially. Now the type of diabetes that most people in Australia get is type 2 diabetes, which is late onset diabetes. And that often is a consequence of lifestyle, inactivity and weight. And you'll find that the majority of people with type 2 diabetes tend to be overweight, don't do a lot of exercise, and this is part of the metabolic syndrome. How they got there is probably either they have a family history or they've made poor lifestyle choices. And often it's by having foods that are high in white carbohydrates, lots of fatty foods, and not a lot of fruit and vegetables. So the more uncontrolled your diabetes is, the more it promotes atherosclerosis or heart disease. And diabetes just doesn't affect heart disease, it affects your kidneys, which then causes your blood pressure to be up. It can affect your eyes and it can affect your brain as well.
Jason, could you talk a bit about aspirin as a way of reducing your risk of heart disease?
So aspirin is a very useful drug at preventing heart attacks and strokes. But what we're getting better at now is seeing who are the people that will benefit most from the use of aspirin. So aspirin is a drug that's been around for many years. You can buy it over the counter in various dose formulations, the smallest being about 81 milligrams up to a usual 300 milligram dose. And aspirin makes the blood less sticky. It inhibits platelets, which is part of our blood's clotting mechanism from sticking together, and it prevents blood clots being formed in our arteries. Now if you've had a heart attack or had any stents put in or have a lot of heart disease, then aspirin is very important for you. If you do have some plaque in your arteries or a few cardiovascular risk factors, then I would recommend most of my patients go on aspirin. But if you're at fairly low risk for heart events and you don't have any heart disease and you don't have a lot of other risk factors for heart disease, then you don't stand to benefit that much from aspirin. Aspirin is generally a fairly safe drug, but for some people it can cause irritation to the stomach, and it's best to have aspirin with food.
Thank you, Jason.
Thank you, Kate. Thanks a lot for coming to see me.